Okay, the last part that I want to cover on plantar fasciitis, ankle, foot problems, things like that, is I want to show you a couple things that you could check on with your kids, because you know a lot of kids do a lot of athletics, gymnastics, cheerleading is very popular nowadays. We have Alex right here. Alex is a cheerleader and she does the flyer position. They do a lot of tumbling, a lot of floor type of work and gymnastics and things like that. So a lot of times what happens with these kids is with the amount of pounding that they do, if the feet are not lining up properly, then what's going to happen is they're going to end up with chronic pain in the plantar fascia, so she'll end up with plantar fasciitis. They can end up with a lot of heel pain. They could end up with a lot of knee pain. And Alex has had some of that as well. So what I want to show you is a couple things regarding her ankle, and then show you how to tape your kids if they're in gymnastics or in a sport like this, because there's a real specific way to tape these things. It's not an ankle taping, it's to tape the Tailless bone, which is the ankle bone, which I'll show you here in a moment. But this is really important for, say, cheerleaders and gymnasts, especially gymnasts, because gymnasts don't wear supportive shoes like sneakers or anything like that when they do their type of routines. So it's a really, really important thing that I want to cover with you regarding, you know, specifically how to tape the feet, and then, like I say, we'll show you a couple simple other adjustments that we can do with children as well. But this also applies to adults, because again, if we have patients with plantar fasciitis, a lot of times, see, an orthotic is great, and we do an orthotic where we put people on a computerized orthotic. It's a computer basically that will scan the feet and take measurements, and then we take measurements of the spine as well as chiropractors. So those are all put into the orthotic. Now a lot of these feed stores that do orthotics, those are mostly just arch supports, and they kind of just, they don't take all the other dynamics into position as to where the knee and the hips and things like that. So that's a consideration. Sometimes you can luck out going those places. I'm not saying they're bad, but to be more specific with the way your foot is, either as an adult or a child, is something that you should see a chiropractor who does more customized types of orthotics like that. But again, we work with the entire spine, so we throw those measurements in there after we computerize the foot. Now, an orthotic's not going to take care of plantar fasciitis specifically. You have to, number one, adjust the bones in the feet. Number two, you also have to, again, get support with an orthotic. But number three, to cut the inflammation down, you want to tape the foot in addition. Okay, and allow that foot to be taped for about a week or two until that inflammation comes out. Then the orthotic and the adjustments will hold better. Your orthotic will have better support. Okay, so let's take a look at Alex's foot. Alex, why don't you stand up for us, and I want to show him something on your feet. Okay, now what I want to point out here is when you look at Alex's feet, you'll see this is her calf, obviously, and this is her Achilles tendon that comes down from this point all the way down here to the heel. Now, if you notice this, her Achilles tendon actually has a bend in it, okay, so it sort of kinks this direction, okay, which indicates that she has pronation in her foot. Now, to test that, I want to show you something as to what an orthotic would do. Alex, I want you to crunch your toes together, okay. Now, as she crunches her toes, can you see how the Achilles starts to go straight? Go ahead, Alex, and just drop your feet normal. Okay, and what you'll see here is the Achilles will start to bend in this direction. The heel will move out in this direction. This will also put a lot of pressure in and around the knee. Go ahead and turn around, Alex. Okay, so what we'll notice here with Alex is that the Tailless bone, which is the ankle bone here, okay, this is the tibia and this is the fibula on the outside, okay, they form a kind of a hinge area here like this, and there's a bone right here in the ankle called the Tailless, which comes up and articulates with that this way, okay? So what we'll notice in Alex on this portion is that the Tailless is fallen. On this portion, it's fallen this way, which would indicate what we call pronation. Just kind of relax and stand normal. Okay, perfect. Okay, so you can see again how this bone is sort of falling in this direction. Okay, now what happens is it'll put a ton of pressure onto the arch, and the patient's going to put too much bearing of weight on this bone area here instead of taking it throughout the entire foot, okay, because there's an arch here and then there's an arch here. Now this arch has to be like this, and then this arch over here has to be like this. So there's basically two arches that we're dealing with like that. So when there's pronation like that, it puts a lot of strain on the plantar fascia, overloads this area here where what we typically call the bunion area, okay, and that's why people get bunions, is because what they end up doing is getting too much weight and stress right over here on the on that first bone or first knuckle over here, okay? So they'll start to get pain in here. Athletes will get a lot of pain in their foot, things like that. So let's show a couple adjustments as to what we would do there, and then show you the taping. Okay, so what we're going to do here is we're going to adjust her heels. The first thing I want to do is we check the heel tension on the patient. Hers seems to be moving pretty good, okay, except for this one. Now, let's take a look here, okay? And look at her heel, how it doesn't move real good. Look how far out this one moves. This one moves pretty good, okay? So what we're going to do here is put our little adjusting board here, okay? And then we're going to just tap her here, like that. Okay, and that's going to set the calcaneus or the heel in that direction. So let's look at the movement now. See how much it moves now? Look at that. Okay, okay. And this one we can actually use a little bit of adjusting on this as well. So let's just do that. Okay, good. Let's take a look. Wow, look at the movement on that thing. Okay, so that's really good. Now the next thing we want to do is we're going to check in here to see if the navicular bone is dropped. It seems to be pretty good. We're going to check her little metatarsals here. Those seem to be pretty good. Okay, this one, it seems to be dropped a little bit. So what we'll do is we'll take our little board here, we'll cock up her foot in this direction, okay, and then we're going to make an adjustment right here on that little navicular. Okay, so do that one more time just to show you. I'll brace it on my knee. Okay, and we'll come in here and we'll make that adjustment. Okay. Okay, does that feel okay?
Yep.
Yep. Okay, great. Kids love this. The adjustments do not hurt. Now, here's the knee that she's a little rotated on her knee. So what I would do here, and the smaller the children, this works really well. We'll just put this drop section here, and then we're going to make an adjustment right here on the fibula. And you'll notice these are, you know, kind of gross maneuvers here as I'm hitting, because I know exactly where that bone is, and I'll make an adjustment here which allows the bone to drop. Now that's perfectly aligned there. This one is, we could use a little bit here. And we'll adjust straight down. Relax your foot. Tighten that one. Okay, good. Okay, so what we're going to do here with Alex is, as her heel was kind of moved outward, there's two ways to do this. You can adjust the heel this way, okay, or we can put her on the Thule board here and get that little adjustment with that little adjusting board. But once again, like I say, when they pronate, as a person pronates this way and they take their weight, the heel will tend to move this way. Okay, so what we're going to do is we're going to actually adjust this heel in this direction. Okay, so Alex, what I would like you to do is lay on this side facing me. Okay, we're going to bend this leg up. Okay, and we're going to just drop the heel this way. Okay, we cock it again. Okay, now flip over the other side. And what we're going to do here is put the foot this way. Okay, we're going to drop the heel straight down. Okay. So we're dropping it in. Remember, when they pronate, the heel rolls to the outside like that. Okay. Let's go ahead and lay in your stomach. Okay. Terrific. So now we're lining up pretty good over here. Okay. We checked all these. Okay. The navicular and these areas seem to be okay. That looks pretty good. Go ahead and roll over on your back. The next thing we'll do is adjust the Tailless, which is this ankle bone here, and I'm going to put her foot up and roll it this way, because again, she's pronating this way, so we're going to roll the Tailless out, give her a little tug, roll it out, give her a little tug. Is that okay?
Yep.
Doesn't hurt a bit. Okay, so next thing we're going to do is I'm going to show you how to tape an ankle here, because it's really important that if you're going to do, if the person has pronation like this, okay, if their foot's pronating, then we have to support that. So I'm going to show you how to do a little taping. Okay, so what we're going to do when we're taping Alex's ankle is we're going to put 3 anchor tapes from around the outside upward, because what we want to do is we want to lift this talus bone up. Remember, when there's pronation in this direction, get this down a little bit, there we go. If we have pronation, which is this, we want to take the tape and lift up here. Now the trick to this thing is this: you don't want to put the tape on really tight when you first put it on. So what you're going to do is you're going to start here, okay, and you're going to work your way around, and then when you get to here, okay, when you get to here is where you're going to lift up and pull. So you're going to pull, I'm pulling hard now, and then I'm anchoring right here in the top, okay? And then we can pull that one off. Next one, overlapping, okay, coming around. See, because if you start to pull here real tight, you're going to cut into their skin, so you don't want to do that. So just come around, just like this. Now, as soon as you get to this point, you see where I'm at this point, this is where the talus is. Now it's what I'm going to do is hold the foot, I'm holding the tape as well, and now I'm going to lift. Okay, you see that? And as I lift, okay, that's not going to hurt them, okay, because now it's going to actually feel pretty good where it's lifting the talus up. So the next one will be right about here, okay, and I'm going to come around. Don't pull hard, just the weight of the tape, okay, coming this direction. Now, right here at this point, okay, I'm pulling that bone, okay. So basically, what you're going to do there is you're going to see how that whole arch is supported when you do that. So again, you're going from outside of the foot to the inside, and remember, this bone is fallen, so now as soon as you get to here, you're going to pull up real hard, and as you pull up, you'll anchor it. So that feels pretty good?
Yeah.
It doesn't cut your skin?
No.
Perfect. Okay, so let's stand up now. Okay, so what I want to point out here with Alex is look at how the foot that I didn't tape is still fallen on that talus bone, which is this bone here. Look at how clean that arch is. Look at how supported this is, okay? Turn to the side just a little bit, Al. Okay, good. Right there. Okay, can you see that arch and how clean that is? Now turn it over and face me this way a little bit. Okay, and see how this one is more fallen? See how this arch is more fallen? No, you don't. You just stay there. That's fine. Okay, see that? Okay, so I hope this gave you a little bit of insight to what to do if you have, number 1, plantar fasciitis, okay, if you have fallen arches, if you have athletes like Alex who are real active, because these kids start really, really young, and they can have a lot of problem going on with their knees because their feet turning in like that. They can start to have a lot of pain in the plantar fascia, which is the bottom portion of the foot. And if you support that area, get a chiropractic adjustment on the feet, which is really important. And then also get a set of orthotics so they can be in that. You're going to save not only your feet, but you're going to save your back from a lot of problems over the years. You're going to save your hip joints, your knees, because as that whole foot turns in, it's going to affect all the specific areas. But this is a great way to help take some of the inflammation out, because a lot of times just the adjustment of the foot or wearing an orthotic is not going to cut it. You have to tape the foot for at least a period, a week or 2, to allow the inflammation to then come down. You can do simple other things like soak your foot in Epsom salts or something to cut inflammation, but this is an awesome way of helping not only young athletes but older people as well for cutting inflammation from plantar fasciitis. I hope this led some insight. This is Dr. Nikitow for the Chiropractic Approach to. Alex, you want to say anything?
I just want to thank you, because now not only does my foot feel a lot better, but I know that it's going to be supported when I go tumble. So.
Okay, great. Thanks again, and we'll see you next time.
Bye.